just want to make sure you're good to go.
I'm good to go. Do I need my phone off mute now?
Yes.
Okay. Can you hear me okay right there with my phone set right there?
We can hear you, and your picture is perfectly clear up on screen too, so thank you.
Okay, thank you.
Well, good morning. We'll go ahead and start out with the report out. Again, a little bit different format that we've been using, but we have today 521 new positive cases for a total of 4,445 positive cases. We had 2,190 new negative cases for a total of 29,783. So yesterday we ran a total of 2,712 tests, which is significantly higher than what we've been running through the testing process. We also have tested a total of 31,973 Iowans, and on a per capita basis, that means 1 in 98 Iowans have been tested. So we really have significantly upped our ability to test Iowans, which I believe is positive. The increase in positive cases today is related to testing that's occurring among essential workers. Again, 30% of Iowa's positive cases are related to manufacturing, and 15% is related to healthcare workers. 1,604 Iowans that were diagnosed with COVID-19 have recovered, for a recovery rate of 36%. Today, I am really sad to report that we have had 11 additional deaths in the state of Iowa, for a total of 107 Iowans who have sadly lost their lives to this horrible virus. Today's deaths, many of them are again among residents of long-term care facilities and, of course, individuals with pre-existing health conditions. Across all of our RMCC regions yesterday, there were 278 COVID-19 patients hospitalized. 44 were admitted in the last 24 hours. 104 patients are being treated in ICUs, and 60 patients are on ventilators. So also in hospitals across the state, there are 3,896 inpatient beds, 534 ICU beds, and 682 ventilators that are available for patient care. The Department of Public Health has also confirmed that we have had one additional long-term care facility outbreak, and that is in Mitchell Village Care Center in Polk County, for a total of 13 long-term care facility outbreaks. Over the last 2 days, the Department of Public Health has deployed our long-term care strike team to conduct surveillance testing of long-term care staff members in Tama County. And this proactive strategy is intended to learn more about increased virus activity in the area, identify and isolate long-term care workers who may test positive, and prevent introducing the virus into their facilities. In total, over the last 2 days, they were able to test 315 long-term care staff. They did both diagnostic and serology testing were offered. Today, I also want to make, so they were able to do both. It wasn't a mandate, but they did the swab testing, and then if they wanted to, they were also able to do the serology test as well, which is a test that detects whether you've had the virus recovered and you have antibodies within your system. Today, I also want to make a personal ask of Iowa nurses. If you are willing and able to volunteer as part of Iowa's response to COVID-19, we need you. As healthcare workers have become sick, nurses are in even higher demand, especially in our long-term care facilities, and especially as we're doing more surveillance testing and really identifying who is tested positive. We're going to need your help. So volunteer opportunities are available through iServe, and that's an online register for individuals wishing to volunteer in the event of a large-scale disaster or a public health emergency. Here to speak more about the iServe and her experience as a volunteer nurse is Lisa Stewart. Lisa?
Thank you, Governor Reynolds. My name is Lisa Stewart. I'm a registered nurse here in the state of Iowa for the last 30 years. I've been a member of the iServe team probably since prior to 2005. What the iServe stands for is Iowa Statewide Emergency Registry for Volunteers. Like Governor Reynolds said, this is an online registry. It sends you alerts for volunteers to help with disasters or public health emergencies. As she also said, primarily at this time we are in need for nurses. There's also a continued need for physicians, advanced providers, EMS, pharmacists, respiratories, and any other healthcare professional. However, if any of you would like to volunteer, don't hesitate to get onto this website and sign up. This could be chaplains, language interpreters, hearing impaired interpreters, clerical workers. Those are just to name a few. If you'd like to get registered, please go to iaserv.org. This way, once you are registered, the Iowa Department of Public Health can determine how many volunteers are available to meet the needs to fill specific roles during the public emergencies or large-scale disasters and even non-emergent events. I just want to mention a couple deployments I've been on and how fulfilling those experiences have been. I was deployed for 2 weeks to Hurricane Katrina. I was deployed to Cedar Rapids in 2008 for the floods, and I've served and assisted with several non-emergent events that the Department of Public Health has provided services for. All of these deployments were very important to the people of those communities that we responded to. On both of the deployments, our teams were put into situations to care for persons that did not have a support system and were unable to care for themselves. Some of the tasks that we did as nurses and medical professionals, we set up a field hospital, we staffed a field hospital, we passed meds, we did daily cares, we did documentation, IVs, and we did a lot of just listening to the patients. This gave me a chance to give back to the community and to help make a small part of the world a better place for those few people that needed the help. Right now, I think this is a time we as nurses need to support our colleagues and that may need assistance in anything at this time. Currently, the iServe teams are support staffing for long-term care facilities, and they're also assisting with COVID testing at several locations through Iowa. I can't stress enough how important this is. Again, the website is iaserv.org. And just a reminder, for all those who have signed up for iServe before, please go online and check all your information because some of it is not updated. and this would sure help for you guys to get the communication to help out in this plan. Thank you, Governor Reynolds.
Oh, well, thank you, Lisa. Thanks for making a difference in the lives of so many people. And I just want to say a heartfelt thanks for helping us spread the word about this opportunity. It is so important and it's so needed at this time. So thank you for sharing your experiences, and thanks for volunteering. I appreciate it very much. So on March 8th, when I announced that COVID-19 was confirmed in Iowa, we started down a path not knowing exactly where it would lead. But we understood the significance of this time and the importance of doing whatever necessary to protect the health of Iowans, especially our most vulnerable. We immediately declared a statewide public health emergency declaration and response that from the start included diagnostic testing, contact tracing, all in a means to better understand the level of virus activity and how best to mitigate and slow the spread. This time has required me to make some of the toughest decisions that I've ever made as the governor of this great state, but they were necessary and they were all made in the best interest of our collective health. And it required every Iowan to do their part as well, whether that meant staying home as much as possible, limiting your trips to essential trips only, working from home, practicing careful hygiene and social distancing, and isolating when sick. And guess what? Iowans responded. I know it hasn't been easy, but it has made a difference. So thank you for doing the right thing for your health and for the health of others. At the time, these bold mitigation strategies were necessary to do as much as possible, as you've heard, to slow the spread of the virus, protect our most vulnerable, preserve critical resources, understand what a surge might look like, and really prevent overwhelming our healthcare system. We needed time to track and understand the virus and its potential impact so that we could respond with precision and force. And we've done just that. With the leadership of the Department of Public Health and in partnership with my team, state agencies, the Iowa National Guard, local public health, the RMCCs, hospitals, clinics, and the private sector, this pandemic required a one-team approach. And I am so grateful for the willingness of everyone to work together to serve all Iowans. The work we've done in Iowa to significantly increase diagnostic testing, conduct serology testing to detect COVID-19 antibodies, deploy strike teams for targeted surveillance, expand contact tracing, and supplement the PPE supply chain, the personal protective equipment, ensures that we have a strong public health infrastructure that we need to continue managing the pandemic while beginning to our economic recovery. While there are some areas in our state where virus activity is still high, we have many more areas where it's manageable or even minimal. And this presents an opportunity to start to open Iowa back up in a phased and a responsible manner. Today, I'm announcing that effective Monday, Iowa health systems, healthcare providers may begin the process of resuming elective surgeries and procedures through a phased-in approach. Fortunately, Iowa has not experienced the healthcare surge other states have. And as you've seen daily through the RMCC reports, our ICU beds, vents are well managed and in good supply. The coordination and the collaboration between providers, systems, and the state gives us the confidence that we can effectively care for COVID-19 patients while also providing procedures to improve health and quality of life for others. On Monday, each hospital, outpatient surgery center, or clinic that determines they can safely do so may begin. They may begin rescheduling patients and resume surgeries and procedures according to their own schedules. In addition, the proclamation that I'll be signing today permits farmers markets to begin limited operations with appropriate public health precautions and provides additional relief to Iowans that are affected by this disaster. So this is our first step of many to reopening Iowa and getting life and business back to normal as soon as possible. On Monday, I will be making additional announcements regarding the first phase of reopening Iowa. And so until then, I want to thank every Iowan for making our comeback possible. Today, we're taking the first steps to get life and business back to normal. But as I mentioned yesterday, it's a kind of a new normal that we're heading into. And so we're going to continue to ask you to do your part. And if we remain committed to working together and doing the right thing, I believe that we will start and be able to responsibly open Iowa back up. And I really do look forward to sharing with you on Monday the details of what that looks like. And again, it will be done in a responsible and safe manner. But we are at a place where it's time to start having that discussion. So thank you. With that, I'll open it up for questions.
Governor, a week from today, the current schedule is for the legislature to resume.
Yeah.
What has been your advice to lawmakers about reconvening inside the now closed Capitol building? And what will be your budget requests of them?
So we're still working on that, and we'll be getting that to them next week, our revised budget. The Legislative Council, I think, is meeting next week. So we've had conversation with legislative leaders and what that looks like. And we'll still be phasing in, reopening Iowa. And so we'll be doing that in coordination with them and talking about a timeline and what that looks like. So, Kay, we're just in the kind of the initial discussions of what that looks like. But after my announcement on Monday and kind of what we're looking at going forward, and we'll be monitoring and watching to see how the phased-in approach is working, I think they'll probably have more information in regards to that next week.
Governor, how do you plan to deal with the farmers market crowds? What's going to be the plan?
Well, that's taken into account. So again, it's outside, so we are asking them to practice social distancing, and the limitations will be listed, so you can find the details in the proclamation. But we're limiting, I think, the type of things that they can sell. We're really tying it to food. We want to continue to make that accessible to Iowans, especially during this difficult time. But they need to set and apply the 6 feet social distancing requirements, not have people gathering around their stand when they're selling their product. And so just continuing to be responsible, and there are some guidelines that are laid out in the declaration.
Is that on the list of things you want to
Well,
get
they've been asking about it for quite some time, and we hadn't had a chance to really work through some of the details. We wanted to work in collaboration with the Department of Public Health and IDLs, and really, again, work with, farmers across the state that had produce and products that they wanted to sell, and we wanted to continue to make that fresh produce available to Iowans across the state. And so we believe that this is a way that we can do that in a responsible and reasonable manner. I have confidence in Iowans to do that, and so we're going to move forward with that. So that was part of the reason. We've been talking about it for a while, and because we were able to do the declaration with the elective surgeries, we were able to add that back in to this as well.
Governor, as you start reopening the state, I was just wondering where we're at in terms of the peak. Have we already hit it? Are we able to kind of determine when that's going to be happening? And how does that play into your decision making with reopening different parts of the state?
Do you want to talk about peak? Okay.
So I think that we fully anticipate that we're going to see a peak here in the next 2 to 3 weeks as we really start to do some of the surveillance testing that we've been doing. When Test Iowa sites start to open up, and we're testing more Iowans than we ever have before. And so I think that we should fully anticipate that our case counts, we had a large jump today, and we did a large volume of cases today, and I think we're going to continue to see that as more of these surveillance testing sites go up and as people start to get access to Test Iowa. So I think that what we can expect is we are going to see our case counts continue to increase, and the peak is really going to occur when our case counts start coming back down, right? That's the definition of a peak. And so I think as we get more access to testing and more people have the opportunity to go through that process, I think we'll see that happen here over the next 2 to 3 weeks.
It appears that the rating system shows that Northeast Iowa's 10 has been reduced to a 9.
Yeah.
Why is that?
Well, so again, as we test more, and like I said today, the hospitalization numbers actually stayed the same, even though we had significant new admissions. We also had significant discharges, yes, in addition to that. So that's remained fairly constant. So the more that we're testing, the denominator continues to grow. That impacts some of the criteria that they're looking at. So we won't make any changes because next week I'm going to be announcing, and April 30th is when the bulk of the declarations expire. And so we're just going to roll into next week, and we'll really be tying that in, Kay, to the announcement that we'll be making on Monday.
Are there any worries? I know some medical associations have said, they have been reusing some of their protective masks, things like that. If we start allowing elective surgeries to happen again, are you worried at all about the supply that Iowa nurses and doctors will have access to?
Yeah, so we included that in the declaration, and this is an option for hospitals across the state and clinics and outpatient procedures. So surgeries and procedures are permitted for inpatient surgeries. If further delay will pose a significant risk to the quality of life, any outpatient surgeries and procedures are permitted. Some of the requirements and guidelines is that the hospital or the provider must have adequate inventories of PPE. They must have access to a reliable supply chain without relying on state stockpiles, and they must have a plan in place to conserve PPE. Hospitals must continue to accept and treat COVID-19 patients and must not transfer COVID-19 patients to create capacity for elective procedures. And the hospitals still must reserve 30% of the ICU beds and 30% of the medical and surgical beds for COVID-19. So we still want to, as we're managing and we're starting to open up and we're looking at, where some of the potential hot spots might be, we want to make sure that we still have sufficient PPE. We're asking them to procure their own if they're going to move into this. We have seen the supply chain start to open up. Even our mission trips that the Guard is running on a daily basis to our facilities, they're down somewhat from where they were a week ago. But so all of those things are taken into account if that they have to abide by if they're going to be able to offer selective surgeries.
We're going to go to Monica, Channel 13. Channel 13, go ahead. All right, we're going to go to Aaron Murphy, Lee News.
Thank you, Governor. Can you address, you're announcing, first, actually, just a quick detail question. The elective surgeries at the farmers market, is that a regional reopening or is that a statewide order? And then can you address starting out this process of reopening at the state at a time when, specifically on a day when we're having the highest numbers of both cases, which I understand are partially tied to more testing, but also we had the most recorded deaths today. Can you talk about talking about reopening at the state at a time when those numbers are at their highest?
Yeah, so it is a statewide on the farmers market and on the elective procedures. So that is a statewide order. So, the more that we're able to test, the more that we're able to do the contact tracing, the more that we're able to do the surveillance testing, as well as the serology testing, all of those components will allow us, and the assessment piece that we're able now to utilize with Iowans all across the state, it really will allow us to target our responses and really identify where some of the clusters and the hot spots are. We have actively been going into areas that we know are, because they're kind of mass gatherings or the close proximity of the workforce. So as we're testing more, we're testing in hot spots so that we can identify, isolate, and start to really make sure that we're protecting the health and well-being of the workforce. And this is key for us to be able to do that. But it also allows us, we had this capability before, but it even gives us additional information and data to really comprehensively monitor the cases through the Test Iowa. And so we're able to look at it not only from a statewide perspective, but we can look at it from a regional perspective. We can look at it on a county by county perspective, right down to a community and a zip code. So all of that allows us to be very targeted in how we respond. It allows us to start to open up other areas where there are no cases or very few cases and haven't been. And even in a lot of the counties that have had minimal cases, they've already had several of them recover. And so you have to take that into account, as well as their hospitalization rates. We can track that. So there's a lot of different variables that we'll be looking at, and we'll take a very targeted approach. So you're not going to see a statewide release on some of these areas that we're going to be opening up. They will be somewhat targeted, and we'll give you more information on that on Monday. And we're going to continue to monitor this. Because of the way that we can monitor it in a comprehensive manner, we can start to open things up very responsibly and on a limited basis, and then we can monitor if we see any issues from that, which would allow us maybe to get in there and identify where that hot spot might be, do some additional communication, or maybe take additional actions if we have to. But again, it allows us to do it in a very responsible and measured manner.
Channel 5, go ahead.
Good morning, Governor. Thanks for taking my questions. I have two today. What is the current stockpile of the state PPE, and is the PPE shortage order still in effect? And also, if there are people not abiding by social distancing at farmers markets, can they be ticketed?
I'll answer that in a second. You want to take the PPE? No.
Yeah, so as the governor mentioned, the PPE shortage order is still in effect at this particular point in time. And as it relates to the allowance of elective surgeries, as she indicated, there are certain prerequisites that the hospitals and the health systems are going to have to be able to meet to be able to do those elective surgeries. So that includes, being able to procure their own supply for those. So the shortage order is still in effect, but it's in effect in conjunction with the proclamation.
Asking the other way. Was verifying over here with my team. As far as the farmers markets, they need to practice social distancing, but as you heard from law enforcement, they're there to educate and help them disperse and help them make sure that they're following through. Ticketing would be a last resort, and I believe in Iowans and their ability to be responsible, and so, I don't anticipate any problems.
All right, we're going to go back to Monica. Monica, go ahead.
Hi, sorry, my connection was a little bit spotty earlier. Thanks for taking my question, Governor. Yesterday I was talking to restaurant owners. Of course, they're super eager to start opening back up again. As you look towards planning for that, a lot of them had concerns about being able to have enough of a heads up to restock and get ready for in-dining services. Are you looking to giving them a little bit more of a notice this time?
Yeah. So, we're trying to be good partners with all of our business and industry, and we've been on the phone with the Restaurant Association. We've talked to them, as well as they've sent correspondence kind of talking what they want to do. So they've been a good partner in all of this. And so next week, when we roll out what we're going to do on Monday, that any of the openings that we're talking about, they would take effect May 1st. So we'll go through the end of the current declaration that we have in first. So the openings that we'll talk about on Monday will take effect on May 1st.
All right, we're going to go to Rod. Go ahead.
Yes, thank you, Governor. I want to make sure I heard, it sounded like you said you were going to submit a revised state budget next week to the lawmakers, and I wondered what figures are you using for your budget recommendations? I believe Kansas is projecting their state revenues will drop by $1.3 billion through fiscal 2021. Do you have similar projections that you're using to rebuild a new state budget plan for Iowa, and how big of a hit do you think Iowa is going to take?
Well, we're meeting with the Department of Management and Director Roeder on a weekly basis, and he's been working with my team as well to constantly monitor the impacts of COVID-19 on the state budget. But, you know, I'm proud to say that our fiscal health was in really good shape when we entered into this. I'm not sure where Kansas was at with theirs, but we had a balanced budget. We had, for fiscal year 19, almost a $300 million surplus, and we had almost $900 million in our emergency account. So and plus we had some, you know, significant funding in the Taxpayers Trust Fund. So we were in a fairly good place heading into this, and we'll continue to monitor and work with the Department of Management as we rework the budget that we submitted and come back, start working on that next week.
We got Jake at KMTV out in Omaha.
Governor, some U.S. senators have criticized the stimulus bill for paying people on unemployment an extra $600 a week. They say it pays people more to stay home and they won't want to go back to work. Do you think your state will have that issue, and does Iowa have anything to deter that?
So Iowans are known for, you know, their workforce participation. I think it's in our DNA and it's what we do. At both the federal and the state, though, if you're an employer and you offer to bring your employee back to work and they decide not to, that's a voluntary, what's the word I'm looking for? Pardon? Oh, quit. Okay, a voluntary. See, we don't have it happen very often. It's a voluntary quit, and so therefore they would not be eligible for the unemployment money. So we already have that place, and I think that's in the CARES rules. And if an employer has an employee that voluntarily quits and decides not to come back, I think they are required to report that to Iowa Workforce Development. So that's state rules and federal rules with the CARES Act as well.
We got time for two more questions. Stephen at the Des Moines Register.
Hi, Governor. Thank you. I guess I have sort of a two-parter here. The first thing I'm curious about is you're talking about announcing some reopenings on Monday.
Yeah.
You've previously said that the federal Reopening America plan sort of aligns with what you want to do, and that plan sort of calls for having a 2-week decline in cases before doing some of this reopening. Obviously, our cases are still rising. And the second part is, I think it's been since like the end of March when we first heard that the state's peak might be 2 or 3 weeks away, and now we're still hearing it's 2 or 3 weeks away. And I guess I'm just wondering what you can say to people to give confidence that we have a handle on where our cases are going if we're going to start reopening things. Thank you.
Well, they've been flat, and so as I've said, we've seen a significant spike, but we are testing a whole lot of people, and we are going into areas that are hot zones. So we know that there's a significant outbreak in the areas that we're going into, and we want to identify that, do the contact tracing, isolate it, get them healthy, and get them through the incubation period, and then, then they'll be ready and able to go back to work. But also, we're able, as I've indicated, to look at this not only from a state perspective, but we can demonstrate exactly what you're asking for in various counties across the state. And so, the Open Up America that the president put out are guidelines for states to look at, CDC. We're working in conjunction at that, but we'll also be looking at Iowa data on a county-by-county level, community level, and see what that looks like. We'll have hot spots that it won't make any sense right this moment to maybe start to open up areas, but we'll have other areas of the state that I think it's like 15 or 19 counties that haven't even had any cases whatsoever. And so we'll have the ability to continue to monitor those to make sure it's not just moving away. With the serology testing that we have available, and we're doing more of that, we're going to be able to identify individuals that potentially have already had it and recovered and weren't even aware of it. 80% of Iowans have mild or no symptoms. I think through some of the surveillance testing, we're seeing more and more people testing positive that were asymptomatic. And so every day we learn more. We have additional testing capabilities and ways that now they're talking about warm weather and sun and the impact that has on the virus. So every day we are learning more and more and more to really help us mitigate and manage COVID-19 and really help us in our decision making as we move forward.
Last question, David Pitt.
Yes, Governor, thank you very much. So you're saying that more than 500 new positives is not the peak yet. We have an explosive situation in meatpacking plants and nursing homes. And yesterday, I think you told me that you said we don't even have the universally viable tool yet to predict when we will have a peak. and it sounds so speculative. I mean, the sunshine stuff that you talked about, that the president mentioned, is so speculative. Nobody really knows what effect that has. I guess I think that's the question a lot of people may have is we're really ready to reopen?
Yeah. Well, David, listen, that was something they're looking at. My point wasn't that tomorrow everybody should go outside and think that this is going to go away. My point is that every day through studies and clinicals and things that are happening with experts in the field, we're learning more and more. And so they're going to confirm that. They're going to continue to study it. It's going to be a long time before that's probably part of the solution moving forward. But my point is to Iowans is that every day we have more tools that we're able to utilize. We learn more about how it's spread. We know that ultimately what we've said from the very beginning is, if you're sick, stay home, practice good hygiene, cover your cough, limit your exposure, continue to social distance. Even as we start to open up next week, we need some of our most vulnerable Iowans and those with underlying conditions. They still need to be very careful about going to places where they could potentially be exposed. So we need them to really continue, as well as all Iowans really, to continue practicing social distancing, to be responsible, to stay home when you're sick, to work from home if you have the opportunity to do that. We're going to, you need to continue to do all the things that we've been talking about. But in addition to that, it's with the data that we'll be looking at, the areas that pertain to that, we're going to look at ways to start to open them up, and it's time. So before we close today, I want to remind Iowans that the Test Iowa location opens for COVID-19 testing tomorrow in downtown Des Moines. Only individuals who took the assessment, qualified for testing, and have a scheduled appointment will be tested. So if that describes you, we're looking forward to seeing you there. Please remember to bring that sheet that has your QR code for check-in. If you do not have a scheduled appointment, please be aware that the drive-up appointments are not available. So to see if you qualify to be tested for COVID-19, go to testiowa.com and complete the assessment. That's for new people that haven't. I wanted to talk about real quick too. So this will be the first site event, Saturday and Sunday, but we are opening up scheduling for Des Moines. So individuals that you've received a note that said you are eligible to test, we are going to be opening up additional testing on Monday and Tuesday, and I think these will be 10-hour days, so we should be able to get quite a few people through. Earlier next week, we will be in Waterloo, so we'll be doing site testing in Waterloo, and we're looking for options in Lynn County, and we will be sending our long-term care strike team to Muscatine to work with long-term care facilities down there, again, to do some proactive surveillance testing and really do everything we can to stop the spread of COVID in those areas and across the state. So thanks Iowans. Thanks for being responsible and doing what we need you to do. Thanks.